welcome to Health Dialogue Show. I'm Dr. Bhumika, and today's show is dedicated to breast cancer awareness, a subject that affects millions of women and families worldwide. With early detection and education playing key roles in improving outcomes, it's important to shed light on the latest advancements, preventive measures, and the importance of regular screening. So, to bust some common myths and to address a few important questions surrounding breast cancer, we have Dr. Santhosh Kumar Devadas with us today. Dr. Santhosh Kumar Devadas has over 11 years of experience in the field of medical oncology and bone marrow transplantation. His clinical expertise includes blood cancers and stem cell transplantation. His other areas of interest include breast cancer and gynecological cancer. He has a keen interest in hereditary breast and ovarian cancer syndromes. He heads the Center of Hematology and Bone Marrow Transplant at Ramaiah Hospitals and has been instrumental in driving the center towards excellence in outcomes and quality. His research interests include multiple myeloma, qualitative research, implementation research, and hereditary cancers. We welcome you to the show, sir. It's a pleasure to have you on board with us today.
Thank you, Dr. Bhumika, for the kind introduction.
So the first statement that we have is a lump is the only sign of breast cancer. So what is your take on this statement?
Yes, to certain extent it is true, as most of the patients do present to us with a lump when they have breast cancer. However, the lump is not the only sign of breast cancer. Many times women can have, or sometimes, as you know, breast cancer is not only the disease of women. Out of 100 breast cancer patients diagnosed, though 99 are women, one patient can be a man also. There is a entity called male breast cancer. We'll concentrate on women breast cancer for the sake of discussion. Women can have obviously a lump most of the times. At the same time, they can have changes in the skin, changes in the way the nipple looks. The changes also may include a secretion from the nipples. It could be bloody or white colored secretion many times. Sometimes they can also have pain, or they can also feel fullness. That is something that we need to remember. Sometimes the women may not have any lump in the breast, and they may present with a lump in the armpit. This is also a common finding. All these symptoms are seen usually in early breast cancer, but if they become advanced, if they become stage 4, if the disease spreads, patients can have multiple symptoms related to other organ sites also, like back pain, can have breathing difficulty, can have abdominal pain, jaundice, etc.
All right. Another question that we have here is, breast cancer always require mastectomy. So is that true?
Not at all true statement. Most of the breast cancers can be managed either by a mastectomy where the breast is removed, or can be removed by a procedure called lumpectomy, where only the tumor tissue and a part of the normal surrounding breast parenchyma is removed. And both the strategies have been compared in a head-to-head manner and have found to be equivalent in terms of outcomes. Hence, when we counsel patients, we say that breast conservative surgery, or also called lumpectomy, is probably equivalent to removing the whole breast in management of breast cancer. What this breast conservative surgery does is it helps the women psychologically more and are able to recover better, because they don't lose the whole organ that they've had for most of their lives.
All right, so that's good to know. Another very common myth is wearing a bra increases the risk of breast cancer.
This is definitely a myth, one has to say. There is no scientific evidence to say that wearing undergarments or a bra increases the risk of breast cancer. and there is no study that or scientific study that proves this uh, fa- uh, uh, particular point, and it's definitely a myth.
All right, sir. Another statement that we have is breast cancer is always hereditary. So, what is your take on this statement?
Among all the cancers known to mankind, if at all there is a hereditary risk, a significant hereditary risk that comes and leads to breast cancer, it is to cancer, it is with breast cancer. However, not all breast cancer are hereditary. If there are 100 women who are diagnosed with breast cancer, nearly 10 women probably have a hereditary risk, or they carry a gene in their genome or in their body, in their circulation, that predisposes these women to develop breast cancer. The rest 90 will not have the gene in them, or will not have a significant family history to state that they have a hereditary risk. They develop breast cancer due to other reasons and not hereditary.
All right, sir. All right. Another question is mammograms are only for older women. So, is this statement true?
Mammograms are a very important tool in picking up breast cancers early. If a breast cancer was supposed to be discovered at stage 3 or stage 4, if you do regular mammograms, maybe it could be discovered at a very early stage, like stage 1A, which means that we are able to cure the early breast cancer in a more successful manner. So, as a recommendation, the mammograms are recommended after the age of 45. So there are two types of mammograms. One is the regular mammogram where a X-ray of the breast is taken. The other type of mammogram is called a sonomammogram, where an ultrasound test of the breast is done. In women who are younger than 45 years of age, if they are inclined to get a screening test, if they are worried that they have breast cancer, or there is anxiety in the family, we recommend an ultrasound of the breast. However, in age 45 and more, the recommendation is to do a mammogram, which is an X-ray of the breast. And the universal guideline for using the screening tool such as mammogram is after the age of 45 years, and not necessarily means that we have to do it in only old people.
So, next myth that we have here is if there are no symptoms, there is no breast cancer.
This is definitely a myth that one has to bust. Many women, though breast is a very superficial organ, are not aware of various symptoms associated with breast cancer, or for that matter, that breast cancer can happen without symptoms. So one needs to be careful, and we encourage women to do self breast examination, to pick up a hard lump in their breast early enough so that they can get medical attention. And many times, just because they did a self breast examination, when, for example, when they were having a bath or changing their clothes, women do pick up a hard lump and bring it to medical attention, and diagnosed early, and have an excellent chance of long-term cure.
All right, sir. The next question that we have here is do antiperspirants cause breast cancer?
Again, this is probably what we call as Google knowledge. What probably many times in the internet, what goes in, many times garbage goes in, garbage comes out. There is again no evidence to say that antiperspirants are responsible for breast cancer. However, one has to note that anything done in excess uh, is dangerous, even if it is totally harmless. If any fad is done in excess, is something that one has to avoid. To underline the fact that there is no evidence that antiperspirants cause breast cancer.
All right, sir. That's good to know. So, how to perform breast self examination at home? Can you highlight some key points?
So generally, what we do advise women is uh, that they use their opposite hand to uh, palpate or feel their own breasts in a orderly manner. One could go in a circular way or in a zigzag pattern from one direction to the other, so that they feel most of their breast parenchyma for any hard or an unusual lump that they may have, they could notice. So we women are encouraged to palpate their left breast with the right hand and vice versa. And this habit, maybe we could encourage women to do it, say once in a week or once in 2 weeks, would definitely pick up a breast lump and bring it to medical attention.
My last question to you is what to expect during a mammogram?
So mammogram, as we discussed previously, is can be done in two ways. In younger women less than 45 years of age, because of their dense breast, ultrasound of the breast is recommended. Once woman reaches more than 45 years of age, 40 or 45 years of age, a X-ray mammogram, which is the standard mammogram, is advised. What women go through mammogram is mainly an X-ray of the breast. The the breast is kept between two plates. There is a bit of a pressure that is exerted on the skin of the breast, and an X-ray is taken in two specific directions. What we call as a craniocaudal view, from top to bottom X-ray is taken, and the second view is called the mediolateral oblique view, where the X-ray is taken from the medials, and that is the inner part of the breast to the outer part of the breast, to look for any density or thickness that gets picked up on the X-ray, or any swelling that gets picked up in the armpits. Sometimes in uninitiated women, it can be anxiety causing, and women also may feel mild pain when the procedure is being done. However, the benefits of a screening mammogram done after the age of 45, once in a year or once in 2 years, far exceeds any concerns that women may have about the mammogram procedure itself. And mammograms definitely save lives when done with the intent of screening for breast cancer.
Thank you so much, sir, for speaking to us today. It was a pleasure to have you on our show.
Yeah, thank you, Dr. Bhumika.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.